Mr. Sultan Amarashad, I hope I pronounced it well. My colleague, the Minister of Health, the representative of the Permanent Secretary to the Treasury, the Permanent Secretary, Minister of Health, the board members of the Uganda Heart Institute, the Executive Director, Uganda Heart Institute, and the other directors present, my paparizi, the press, distinct guests, ladies and gentlemen. Good morning, all of you. I take this opportunity to welcome you and your team to this occasion, where we've just witnessed the signing of the loan agreement worth Saudi Riyals 112,500,000, equivalent to US dollars 30 million toward the construction and equipping of the Uganda Heart Institute. On behalf of the people of the Republic of Uganda, I want to extend our heartfelt gratitude for the beneficial and cordial cooperation with the Saudi Fund for Development, not only in the sector for which we have signed today, but also in other sectors like education, among others. I would also like to take this opportunity to thank the Arab Bank for Economic Development, BADEA, and the OPEC Fund for International Development, who have each contributed US dollars to 20 million as co-financing with the Saudi Fund for Development to support the Uganda Heart Institute. Your Excellency, we envisage that with this support, when the project is complete, there will be an increase in the number of patients handled annually in Uganda, with one, outpatient attendances from 22,000 to 65,000, two, admissions general from 2,000 to 15,000, three, ICU and CCCU admissions from 800 to 5,000. 4, cardiothoracic, vascular, and other surgeries from 100 to 500. 5, open heart surgery from 100 to 500. And finally, 6, catheterization procedures from 600 to 4,000. The financing from Saudi Fund for Development will specifically support the civil works, equipment, and furniture, which form a big portion of the project. I urge my colleagues from the Ministry of Health, where this loan will be executed, to ensure that all government obligations are fully met and to ensure that any issue that may delay the project is handled expeditiously. I will not accept any delays in implementation of this project. I want to affirm to the Chief Executive Officer that we shall fulfill our obligations under this loan in a timely manner. We shall ensure that the support is used for the activities that have been agreed between ourselves. We will furnish the bank with information and data concerning the progress of the implementation of the project through regular reports. I thank you very much for all of you for listening to me, and you are most welcome. You are excellent. Thank you.
Ladies and gentlemen, distinguished guests, government official, I am honored to be here today in the beautiful country of Uganda. to sign this development loan agreement for the construction and equipping of the Heart Institute project. The Heart Institution project will be funded through a collaboration of entities with a shared vision of improving the health and well-being of people around the world. The Saudi Fund for Development is contributing $30 million to this project, which will support the healthcare sector in Uganda. Your Excellency, ladies and gentlemen, heart disease are the leading cause of death globally and a major public health threat on Uganda. I am proud that the Saudi Fund for Development is playing a role in helping addressing this challenge. This project will play a huge role in supporting the country's healthcare sector by improving the quality of the health sector and increasing the capacity of patients receiving medical care at the Heart Institute. Additionally, it aims to provide new equipment and facilities, and train health workers. In addition, the project will raise awareness of heart disease among the public and improve the lives of many people. Your Excellencies, since SFD established, we have worked for more than 49 years in providing development support for developing countries around the world. Our partnership with the government of Uganda started in 1975. We have then financed several development projects to cover energy, health, agriculture, and education sectors. It is our belief that all countries deserve the opportunity to achieve their sustainable development goals. Finally, Your Excellency, the project is very close to our hearts, as it is about giving people hope and the chance to live a long and healthy life. SFD is proud to be a part of this project, and we are confident that it will make a real difference in the lives of the people of Uganda. I would like to extend my deepest appreciation to Your Excellencies, the government and the people of Uganda for your warm welcome and generous hospitality. I wish your country continued growth and prosperity. Thank you very much, Your Excellency.
Today marks the beginning of a transformative journey for the Uganda Heart Institute. It is indeed a momentous day as we witness the final signing of the loan agreement for financing the building and equipping of Uganda Heart Institute project by the Saudi Fund for Development. The four funders for this project include the government of Uganda, providing $3 million per day, $20 million, OPEC Fund for Development, $20 million, and Saudi Fund for Development, $30 million. To the Saudi Fund for Development, your willingness to invest in the healthcare sector of Uganda demonstrates your commitment to improving the lives of Ugandan citizens and your faith in the future of this nation. Your substantial financial support will undoubtedly leave a lasting impact on the healthcare landscape of Uganda, and for that, we are immensely grateful. This state-of-the-art facility will position Uganda Heart Institute as a global center of excellence in cardiovascular services. The citizens of Uganda, and in particular, patients, healthcare professionals, researchers, and training experts will benefit from this state-of-the-art facility. I would like to extend our profound gratitude to the Honorable Ministers of Finance, Planning and Economic Development and the entire team at the Ministry of Finance for your unwavering commitment to improving the healthcare infrastructure in Uganda. Your dedication and tireless efforts have made today's milestone possible. To all the stakeholders who have been instrumental in bringing this project to fruition, such as the National Planning Authority, Uganda Land Commission, and Kampala Capital City Authority, among others, your collaborative efforts have been pivotal in achieving this significant milestone. To the board of Uganda Heart Institute, we are eternally grateful for your guidance and the good work that you have done. As we look ahead, let us focus on completing this project within the specified period of time to serve the people of Uganda and fight the burden of cardiovascular diseases in the country. We remain committed to providing accountability from time to time and seeing to it that this project ends within the stipulated time. For God and my country.
Heart disease or cardiovascular disease is becoming a big problem in the country. It is on the increase, and where we are, already 1% of all babies born, 1% already have a heart problem. Just like any factory.
For babies, I thought the heart problem comes with people who are
No,
like Kasanya here.
the issue, yes, the issue is even any factory has factory reject. So for a human being, it is so efficient that it is only 1%. So in the country, right now our population is about 48 million. We are delivering about 1.6 million babies. 1%, that is 16,000 babies are born with heart disease per year in our country. And half of them, who translates to 8,000 babies, would require an intervention if they are to live a normal life. Then in the middle are those ones who get out of infections and other things. We are estimating that at 500,000 children in the country get either rheumatic heart disease or any of these TB pericarditis or any of these viral conditions. Then when they transit to adult life, it is an issue of lifestyle, failure to balance what you eat with what you spend. So the body has to transform any excess of what you have not utilized to fats, and that is cholesterol, and that is what leads to ischemic heart disease and the hypertension and all those things. So where we are now as a country, 1 in every 4 adults, 1, 2, 3, 4, 1, 2, 3, 4, and anybody counting already has hypertension. That means 25%, and that is a quarter of our working population already has a problem. Even HIV at its maximum did not reach this level of taking away a quarter of our working population. But here we are, heart disease has already reached that level. Already when we look at even our data, almost 41% of the total deaths and all these people in hospital, it is now moving to non-communicable diseases, which includes cancer, chronic airway disease, and bring in even things like a cell. So in total, this is a big problem, and we are on the rise. We have not yet reached the level of controlling. And the other aspect, the press has to help us disseminate that 80% of the people whom we even pick with this heart disease, cardiovascular disease, even don't know that they have the problem. So there is a knowledge gap which we all have to address. And through this project, We are doing a lot of the issues of training, raising public awareness, training. We are doing all the training of health professionals, right from nurses through to doctors, through to all these super specialists. All of them must know that there is the issue of cardiovascular disease. So to increase the awareness, we have also moved now to the public, to the education sector. Now we have included the danger of cardiovascular disease and the issues of feeding and the issues of physical exercise into all the school programs. So all the children coming up must know about heart disease and how to prevent it. And it is us as the Heart Institute who are to give that data. And then finally, with this project, we are moving in line with the National Development Plan 3 to develop the right capacity to treat and manage our cardiovascular disease within the country. So with this project, we are able to support even the other 13 centers at the regions, and we shall be coming back to write new projects. And I am asking Sultan in advance, know that we have to put up 13 small health, let me say, heart institutes all over the region, and we have already set up universities. So the issue is to combine care and academia such that they work together. And those places already have city status, they have the 13, let me say, the government universities, and now we have to set up the 16 centers all over the country, such that people don't have to move long distances. When we raise their awareness through education, and we improve the feeding and the rest of the things, we should be able to catch only those ones who get the disease early, and then cater for those ones who get it in old age, because old age is also a contributory factor. Thank you very much.
Eno ye Salam TV.